After trying unsuccessfully to conceive, many couples find that it is harder to become pregnant than they believed it would be. Unfortunately, there can be many contributing factors to infertility, sometimes making it difficult to determine what is causing the fertility problem. Some couples who face infertility will have to undergo extensive fertility treatments to help them conceive, while others may just need to make some simple lifestyle changes that can help boost their fertility. There are a variety of simple, effective ways to help improve a couple's chances of conceiving. These natural techniques can be beneficial for all couples trying to conceive. Watch your weight. The healthy BMI has been linked to increased fertility in both men and women. This is because your weight affects your body's hormone production. Being overweight leads to decreased sperm production in men and decreased frequency and consistency of ovulation in women. Balance your diet. A big part of watching your weight means eating right. While no research suggests that one specific diet increases fertility, a balanced diet promotes overall health, including reproductive health. Stay active. Another important step in maintaining a healthy weight is to get plenty of exercise. In men especially, moderate exercise can help produce enzymes that help to protect sperm. Avoid exposure to sexually transmitted infections. STIs, especially chlamydia and gonorrhea, can cause infertility in both men and women. Both of these STIs can occasionally present asymptomatically without warning signs. Quit smoking. Use of tobacco products is another leading cause of infertility amongst both men and women. Women who smoke risk aging their ovaries and depleting their eggs prematurely. Reduce your alcohol consumption. Experts have linked alcohol consumption to a number of fertility complications in both women and men. Heavy drinking can cause ovulation disorders in women, making it more difficult to pinpoint when you are most fertile. Check your lubricant. Consider skipping additional lubricant during sex if at all possible. Many lubricants contain chemicals that will kill sperm or make it more difficult for sperm to reach the woman's egg. Cut out caffeine. Consuming too much caffeine has been linked to fertility issues, especially in women. Experts in family planning suggest that women trying to become pregnant should limit their intake of caffeine to less than 200 or 300 milligrams each day. Work days if possible. Working swing or graveyard shift often affects one's sleep schedule, which can also affect reproductive hormones. If you work nights, see if you can't switch to day shift at least temporarily. Discuss your medications with your doctor. Some medications such as calcium channel blockers and tricyclic antidepressants can lead to reduced fertility. Avoid exposure to chemicals and toxins. Both women and men should limit exposure to chemicals and other toxins, which can lead to menstrual disorders in women and reduced, damaged sperm counts in men. Reduce stress. Increased stress levels may also affect reproductive hormones and fertility in both men and women. If you experience high levels of stress in your work life or at home, then ensure you take time to relax with meditation, your favorite hobbies, or any other preferred stress-reducing activity. Avoid high temperatures. Temperatures in excess of normal body temperature around a man's scrotum can affect sperm production. Wear loose, breathable underwear such as cotton and avoid hot environments like saunas and hot tubs. Track your cervical secretions on a calendar. Women can track their body temperatures and changes to their cervical mucus to determine when they are most fertile, collectively called the symptothermal method. Check the mucus when you urinate. One of the easiest ways to check is to wipe using toilet tissue before urinating first thing in the morning. Note changes to the mucus during your cycle. You will notice several distinct changes to your cervical mucus throughout the month. Track your basal body temperature on the same calendar as your cervical mucus. Your basal body temperature refers to your temperature when you're completely at rest. Record your temperature before you get out of bed every morning. To get a consistent basal temperature under the same conditions each day, keep your thermometer at your bedside and record your temperature before you get up in the morning. Try to conceive on the days when you're most fertile. Your most fertile day is approximately 2 days before your basal temperature rises. By tracking both your cervical mucus and your basal temperature,